Hello, my dear friends. Welcome to another episode. So, today we are going to deal with gastritis. Let us talk about gastritis. So, what is gastritis? It is an inflammation of the stomach lining. जो हमारा stomach में है, linings जो होता है, जो हमारा gastric acids है, enzymes है, bacteria है, जो healthy वाला, non-healthy वाला, इन सब से बचाने के लिए there is stomach lining inside our stomach. Any inflammation to this stomach lining will result in the gastritis. The stomach lining is a mucus lined barrier that protects the stomach wall. जो हमारा stomach wall को protect करने के लिए लाइनिंग्स होता है, उस लाइनिंग्स को जब इन्फ्लेमेशन हो जाता है कुछ इन्फेक्शन की वजह से, कुछ जो भी कॉसेस है, उसको हम गैस्ट्राइटिस बोलता है। सो एज आई सेड, जो स्टोमक लेयर्स है, स्टोमक लेयर्स को इन्फ्लेमेशन होता है, उसको जब हम गैस्ट्राइटिस बोलता है। सो दिस इज द स्टोमक लेयर। हियर यू कैन सी अ पिक्चर ऑफ द स्टोमक लेयर वेयर सबसे आउटर मोस्ट वाला लेयर है serosa, and to inner to the serosa is the muscularis externa, and then comes the submucosa, and then comes the mucosa. So mucosa is the most inner layer of the stomach. So any inflammation to these, any infection to these layers of the stomach, it results in the gastritis. Gastric juice is very essential for the breaking down of food particles and for the absorption of all the nutrients into our body. So gastric juice में क्या होता है? Water 99%, 99.5% water होता है, बाकी solid से 0.5%. इसमें organic substance भी होता है, inorganic substance भी होता है. जो organic substance में enzymes है, like mucus है, intrinsic factor है, vitamins है. इनऑर्गेनिक सब्सटेंस में जो HCl है, सोडियम कैल्शियम क्लोराइड है, ये सारा चीज़ें होता है। सो क्या करते हैं, जो भी एंजाइम्स है, जो फैट्स, जो भी प्रोटीन्स है, इन सबको जो हम फूड पार्टिकल्स खाते हैं उसको ब्रेक डाउन करने के लिए इट्स वेरी एसेंशियल. एंड ऑल्सो द स्टोमक लाइनिंग प्रोड्यूसेस द HCl which is essential for the to inactivate the swallowed microorganism and thereby inhibiting the infectious agent from reaching the intestine. So that is about the gastric juice. Why gastritis? It is mainly caused by the H. pylori infection, multiple infection with H. pylori, and alcohol use, chronic usage of alcohol use, steroids, NSAIDs, antibiotic habitually using will lead to the erosion of the stomach layer, leading to developing gastritis. Autoimmune disease, where immune system attacking our own healthy cells in the stomach layer, leading to the gastritis. Radiation, as a result of the precipitating or the factors such as a patient taking radiation, chemotherapy, will lead to a chance of developing gastritis. And bile reflux, bile related problem, especially from the intestine. The bile is traveling backward to the stomach. Increased acid in the stomach will lead to the erosion of the stomach layer, leading to gastritis. So these are the causes of gastritis. To explain about pathophysiology, we already know the predisposing factors, the precipitating factors. So the main causes such as the dietary problem or the intake of alcohol, steroid, NSAIDs, antibiotic use, autoimmune problems, bile refluxes, or the H. pylori infection. All these causes or any of these causes will lead to the gastric mucosa membrane erosion or edematous or the hyperemic congestion. Hyperemic matlab congestion with the blood. It is congested with blood and the fluid, and this is the first stage. After that, again further superficial obstruction of the gastric mucosa results, and later on what results is decreased gastric juices. मतलब acid जो secrete हो रहा है तो कम हो जाएंगे, and more mucus is resulting, and that leads to superficial ulceration, and signs and symptoms will be shown by the patient such as diarrhea, nausea, vomiting, or headache, or anorexia, hiccuping, abdominal discomfort. If it is treated, it can be treated within 24 hours. Patient recovers within 24 hours, and sometimes the patient might be having appetite related problem, and that will resolve in within 2 to 3 days. But if it is not treated, the patient goes to GI bleeding and then to the shock and death of the patient. What is shown when a gastritis occurs in a patient? Mainly, the patient might be having symptoms such as the burning sensation, a heartburn will be there, abdominal pain can be there, abdominal bloating. Bloating will result a feeling of fullness inside the stomach, and that is why the patient feels a loss of appetite and indigestion because abdominal bloating, properly digestion is not taking place. Patient feels a bloating and hunger, no hunger, and vomiting and diarrhea can be there, and due to the vomiting and diarrhea that can leads to dehydration, and that further complication results in headache. So these are the symptoms. How we can diagnose gastritis, or what is the reason for this gastritis? So we will do endoscopy using an endoscope. The endoscope is passed into the mouth to the esophagus and into the stomach to visualize what is happening inside the stomach. That is one test. Upper GI series, it is a kind of X-ray where in fasting patient is allowed or advised to drink a chalky barium containing fluid or liquid, whatever, and that will and using a fluoroscopic x-ray while motion how the stomach is, so how the organs are, so that is monitored after swallowing the barium. So that is upper GI series mainly for esophagus, duodenum and stomach. And ultrasound machine using to detect the in the inside of the stomach, the normal regular test for the gastritis. CT abdomens are there, stomach biopsy, sample or tissue, a small tissue portion is taken and sent for the histopathology to rule out if there is any associated carcinoma or anything is there or not. H. pylori breath sound. It is another urea breath sound test where non-harming urea containing capsule is swallowed in empty stomach, and after that a baseline breath is captured in a bag or tube, and then this is given. So after swallowing this urea containing capsule, again the breath is collected in a bag or tube, and then if there is presence of H. pylori, it will break the urea, and detectable amount of carbon dioxide will be present in the breath the taken after. So that will be monitored to rule out if there is H. pylori infection. So that is another test. Then stool test and blood test for the microorganism, which is the main reason, or any other abnormalities or change in the values is there or not. So that is how the diagnosis for the gastritis. So what all treatment is given for the gastritis? The management, it include antibiotic. If it is a H. pylori infection, antibiotic is given to the patient for the treating with the microorganism, and the patient has pain, then analgesic is given. Proton pump inhibitors and antacids are given to decrease the acid secretion so that it will promote the healing of the stomach layer. Diet, what all diet management is prescribed or advised for the gastritis is soothing diet such as unsweetened milk. Unsweetened milk is given, banana, curd. So these are probiotics which is good for gut health, and avoid stimulants such as the tea, coffee, and also bland diet is advised to the patient. Avoid no spicy food, non-spicy food such as khichdi, Delia is advised to take, and the stress management, because stress also plays a role in gastric related problem. So stress management, it can be if there is a chronic stress, then it can be managed properly with therapies, counselings, meditation, medication, and in lifestyle modification, patient is advised to for the proper diet, sleep, and importance of exercises. And the surface coating agents. What is surface coating agents? It will create a coating over the stomach layer so that the contact with the acid is decreased and it promotes healing. So surface coating agents such as sucralfate is given. Vitamin supplements, essential supplements are given for the good health, gut health. So these are the treatment: antibiotic, proton pump inhibitor, antacid, lifestyle modification, diet, analgesics, stress management, vitamin supplements, and surface coating agents. Thank you. That's about gastritis. If you like the video, please subscribe to the channel and feel free to comment regarding it. Let us see soon in another video. Thank you so much. Stay tuned with Anjali's MedSphere.